welcome to Resilient Realities, a podcast on society's struggle. I am your host, Najeeb, and I welcome you to the first episode, which is Discrimination against Autistic People. The main aims for today are as follow: that you must be able to understand what is Autism Spectrum Disorder, how it affects people, and how those people are discriminated. Let us move forward and welcome our guest, Dr.Samreen Afzal, who is a very well-known and acclaimed clinical consultant psychologist known for helping special needs children. So, Dr. Samreen, how are you?
Fine, thank you.
Can you please introduce yourself?
Yes, my name is Samreen Afzal. I am a senior clinical psychologist providing my services since from 2009 in my community, and my area of interest and specialty is special needs.
Okay, can you please tell us what is autism spectrum disorder?
Yes, this is something. Autism spectrum disorder is a neurodevelopmental disorder in which the communication is limited and person is or a child is unable to socialize and have some stereotypies.
Okay, so how does autism affect people's social relations, communication, and conduct?
Yes, this is something very important, and in this condition, the child is not able to communicate in a right way. We perceive communication in terms of speech, but communication is verbal and non-verbal. We have seen that mostly the communication is impacted in this kind of condition.
How is it impacted?
It's like child is unable to speak a words or express according to the need, and they are living internally and unable to interact with social environment.
Okay, so are there different levels or variations of autism, and how does that impact the treatment approach?
Yes, there are levels. First of all, there is a need to identify the early signs of the autism spectrum disorder. This is a spectrum. Basically, when we talk about the spectrum, it means that symptoms are scattered. Okay, it can be intense, it can be variable, it can be mild, moderate, severe, or that it can have like some few signs of autism spectrum disorder.
Okay. What are some common misconceptions or myths about autism that often occur, and how would you try to solve them?
There are so many things according to social norms and cultural values which people are like stigmatizing all mental health issues. And when we are talking about the childhood related issues, then parents are the main sufferers basically, because they have their emotions attached with such kind of like you know that with family member, with children, they have the bond. And when they become aware about the condition of autism, first of all they deny the state, and later on what they are hesitating in seeking help because they feel stigmatized that society will not accept it. And this is something, and you can say the autism is the condition about which people are not aware that much. Even those who are with effects, they are not able to understand what kind of symptoms a child can have.
Okay, so my next question is also linked with parents. How can parents support autistic people with their daily lives, and techniques that can be possible in promoting their well-being and growth?
This question is very good from your part, and I appreciate you people a lot for such kind of things, because when we are talking about treatment or management strategies, then we are also raising the voice to generate the awareness in the society. So, first of all, early identification is key to success. You can say if earlier we will diagnose the child or having some kind of symptoms, we will pick it first of all, and later on, then we seek professional help. And parents should know what are the signs and symptoms from where they have to take the right kind of treatment, and the treatment methodologies which are being used in such kind of conditions are applied behavior analysis. There are few strategies, and we focus upon early readiness skills in which we teach the child how to sit, how to interact, how to build eye contact, and how to socialize. They have the speech. The problem is with the communication level. They are unable to communicate because innerly they are not feeling the need that external world is existing. So our focus is to train them to relate to external environment, And for that, multiple strategies and therapies are being used on the level of individualized training plans. And we give the plans to the parents as well to educate and train children at home, and we deliver them the plans to administer at home as well.
Can you give one example of the plans you're talking about?
Yes, I'm talking about individualized training plans in the aspect of early readiness skills. And as I have already explained, that we will focus upon few skills initially. Like we will teach them how to do the eye contact, how they will follow the command, how to sit on the seat, and we will teach them to imitate, because most of learning is when we watch someone, we as a role model, we learn the things. These kids are lacking in such kind of things, and they are unable to relate from their environment.
Are there any conditions or mental health disorders associated with autism, and how do you take different approach?
So, as you already, I have explained it, that it is a spectrum, and spectrum means that scattered things. And regarding other neurodevelopmental disorders, they can comorbid with such kind of things like with intellectual disability, with ADHD, and other conduct-related issues.
Okay. What role does early intervention play in the management and outcomes of autism, and what are some early intervention techniques that have proved effective?
Early intervention is something which is like universally we are raising voice regarding this, that earlier you will bring the child and identify the sign and symptoms, and get professional help, and in right direction you will go to for therapies. Then only then child can be trained in certain ways, and it can change their lives.
Okay. How can school and educational systems accommodate autistic people in the learning environments?
I think so that we have already talked about the early intervention strategies. If we will focus upon the earlier intervention strategies, the better would be the outcome. This is our slogan too in all aspects of neurodevelopmental disorder, and particularly if we are focusing upon autism spectrum disorder, then earlier the intervention, better would be the outcome. And particularly if we will raise the awareness and bring such kind of kids earlier to the setups, and later on school can be a very, like, they should have the inclusive settings for such kind of kids. But the treatment methodology, or teaching methodology that can be effective, it should be one-to-one.
Okay. So the last question, are there any advancement in the field of autism that you find promising, and how do you see the future of autism diagnosis and treatment evolving?
In the whole universe, I must say that globally too much work is towards this, but I would like to elaborate one thing more, that I have seen that from previous 2 to 3 years that this kind of diagnosis is more into a fashion, which is not good. It should have a certain criteria, and everyone should, a clinician or a therapist or a psychologist or a psychiatrist who are expert in the field, they should diagnose it properly. And early identification is only key to success, and we can make that difference. And over here, where we are giving the services in our setup, there are so many kids who have developed the speech, or they are on, like, the concept in whole universe is to promote the functional speech. Functionality is something in which child can show the needs. Okay, so if we will train the kids in a nice way and promote mental health awareness programs in society, only then we will be able to adjust such kind of kids.
Thank you so much for your precious time, doctor.
Thank you.
Welcome to the second part of this episode. Today, we are honored to introduce our remarkable guest, Ms.Amna Najeeb, a clinical psychologist who brings a unique perspective to our discussion. Not only does Ms.Amna possess professional expertise in this field, but she also has a deeply personal connection with a autism loved one. In the second segment of our episode, Ms.Amna will graciously share her insights and experiences, shedding light on the challenges and triumphs faced by individuals and families affected by autism. Join us as we delve into a conversation that aims to foster understanding, empathy, and inclusivity. Welcome, Ms.Amna, and thank you for joining us on this important journey. Hello, Ms.Amna, how are you?
Hi, I'm fine. How are you?
I'm fine too. Thank you for being a part of this podcast.
You're welcome.
So, moving on to the first question. So, how did you find out that your relative has autism? What was your initial reaction and how did you cope up with it?
Firstly, it is Zinda. It's my uncle's son. I observe his behavior because we are living in a joint family, so I do observe his behavior daily. As I'm also a clinical psychologist, so I when I observe his behavior, his typical movements, his stereotypical movements, his delayed speech, I just notice that he is meeting the criteria of autism. So just like autism has a specific criteria like delayed speech, not maintaining eye contact, meaningless speech, attention deficient, hyperactive. So I suggested his parents and I psychoeducate them that this situation is like totally fine. You can just go and do some type of assessment with. I did his parents. I psychoeducated them and I motivated them for the treatment.
So, what are some of the joys and difficulties of raising or caring for an autistic person? How do you balance your own needs and those of your family?
It can be rewarding to see the unique perspective and strengths of autistic child and individual. But it also comes with its challenges like navigating communication difference and sensory sensitivities. Balancing your own needs and those of your family is crucial. It is important to remember that taking care of yourself allows you to better care of others. Setting boundaries, seeking support from professionals or sport groups, and practicing self care, practicing like mindfulness, meditation, engaging in hobbies or activities, regular exercises, and do relaxation are essentials to maintain a healthy balance. Taking care of yourself is crucial when you are caring others.
Of the resources or services that you use or need for your autistic loved one, how do you access them and what are the challenges or barriers that you face?
Assessing services and resources for them can be challenging. Like some common resources include therapy services, educational progress, sport groups, and assistive technologies. Finding these resources can be tough due to long wait lists, limited resources, availability, and financial issues.
Communicate and interact with your autistic loved one. What are some of the strategies or tools that you use or recommend?
This is a nice question. When you are communicating and interacting with an autistic loved one, it is important to use clear and simple language, provide visual support, provide schedules, establish a routine, be patient, and give them time to process information. Tools like schedules, establish a routine, be patient, and give them time to process information. Tools like visual schedules, social
Support your autistic loved one's education, employment, socialization, and independence. What are some of the goals or aspirations that you have for them or their family has for them?
Supporting them in education, employment, socialization, and independence is crucial. Setting individualized goals and aspiration can help guide the support you provide. This might include focusing and developing their communication skills, helping them access appropriate educational progress, assisting in finding suitable employment opportunities, and promoting social interactions to enhance their social skills and independence.
Handle medical, legal, or financial decisions for your autistic loved one.
Handling medical and legal financial decisions for them can be complex. It's essential to have support network in place such as legal guardianship or power of attorney to assist with decision making. Seeking advice from professionals like doctors, lawyers and financial advisors can also be beneficial in navigating these areas.
Deal with stigma, discrimination, or misunderstanding from others about autism. How do you educate or advocate for your autistic loved one and the autism community?
Dealing with stigma, discrimination, and misunderstanding about autism can be challenging. It is important to educate others about autism to promote understanding and acceptance. Advocating for your loved one and the autism community can involve raising awareness, sharing personal experiences, participating in groups, and engaging in advocacy campaigns.
Thank you, Ms.Amna, for your time.
Welcome.
Greetings, everybody. Welcome to Resilient Realities, a podcast on society's struggle. I am your host, Khadija Naveed, and I welcome you to the second episode, which is Unrealistic Beauty Standards. The main aim for today are that you must be able to answer 1. What are various beauty standards? 2. How do different beauty standards affect people? 3. How it affects the dilemma of the society. So now let us move forward and welcome our guests, Ms.Amna Najeeb and Ms.Amna. As we wrap up today's podcast on autism, I want to extend a heartfelt thank you to our guests, Dr.Samreen, Afzal, and Ms.Amna Najeeb, for sharing their insights and personal experiences. Their expertise and first-hand perspectives have shed light on the complexities of autism spectrum disorder. To those listening, whether you are a parent, a caregiver, or someone navigating life on the spectrum yourself, remember that understanding, acceptance, and support are key. Each individual with autism is unique and their own strengths, challenges, and potential. As we continue to learn and advocate for greater awareness and inclusion, let's strive to create a world where everyone, regardless of neurodiversity, is embraced for who they are. Thank you for joining us today, and until next time, remember, together we can make a difference.